Hi, my name is Jonathan Canamella, and I'm a board-certified radiographer with a subspecialty board certification in computed tomography, or CAT scan. I'm also a member of the American Society of Radiologic Technologists. And, we're going to talk a little bit about CAT scan today. There are several areas of the field that I have been posed questions about, so I'm going to try to answer those to the best of my ability through my experience and my education. One of the ways that the CT machine has revolutionized the medical world is basically allowing us to create diagnostic images with three-dimensional images of the human body slice by slice from head to toe. It's an extremely precise and accurate imaging system which allows radiologists to assist other physicians in the diagnosis of various diseases in the various body systems, from neurological to epidermal and everything in between. The American space program has played a very large role in the medical field, especially the medical device field. Specifically, there are many areas we can look at in terms of how CAT scan has been affected by the space program, specifically the Apollo program. However, when I speak about the space program, it's really CAT scan and the medical device world has been affected by both the Apollo programs as well as the shuttle programs. It's hard for me, in terms of my knowledge, to separate the two. I can tell you that although CAT scan was invented without the help of NASA's space programs, a very critical system in CAT scan was developed through digital image processing. CAT scan and MRI, in terms of a diagnostic value, would probably not be possible without the digital algorithms and mechanisms that NASA developed in processing digital images taken from their various probes and vehicles. That digital imaging process center allows the data collected from the CT machine as well as the MRI machines to be processed through a series of computers, which then takes that data, which we call raw data, and process it into a fine digital image, which is a representation of the human body. So that was extremely helpful, critical, in fact, to the commercial use of CAT scan machines. I know definitely off the top of my head that the artificial heart got a huge boost from the space program, as well as the cardiac pacemaker. Those two devices, which are commonly used, one when patients are waiting for a transplant of a heart, as well as the cardiac pacemaker, which is used and installed in many people every day in hospitals around the world, help regulate the heartbeat due to irregular heartbeat, which can cause various abnormal arrhythmias or irregular heartbeats, and a particularly dangerous one called atrial fibrillation, or AFib, which is known to produce and throw or move clots throughout the system, causing things like heart attack and stroke. So the cardiac pacemaker is a huge breakthrough in medical technology. Diabetics have reaped the benefits. Also, certain types of insulin pumps used from propulsion systems have been developed from NASA technology. Those are installed and they deliver measured doses of insulin to patients. So that is important. Radiation and cancer treatments have also benefited, as well as bone marrow and stem cell transplants have also been developed through the space program. The function of the CAT scanner, in the most simplest form, is essentially a person is put on a table in a donut-like aperture called the gantry. It's kind of the housing of the CAT scan machine. The table is then moved in an interval, generally relatively slowly, while a X-ray tube, which is mounted across from a fan or banana-shaped image receptor, spins around the person in a helical spiral or 360-degree motion. As it spins around the person, the table moves in, and it images the human body slice by slice, which is set by the operator, and picks up data slice by slice, generally from head to toe. It can be from foot to head as well. That data is then translated through the use of a computer based on something called attenuation or absorption rate. And essentially what that is the human body is made up of various tissues and bone. Each of them are slightly thicker than others or denser than others. And as the X-rays are generated from the X-ray tube, they penetrate the human body. And the remainder of the X-rays that comes out the other end is the difference, and that difference is then measured. More X-rays are generally attenuated in thicker tissues such as bone or dense organ, and less X-rays are absorbed in areas where that is less dense, such as fat or air, such as the lungs. And the machine can tell that, and then it processes it using a mathematical algorithm, and then an image is formed. We are able to reconstruct the human body three-dimensionally, which is pretty quite amazing because the radiologists, which are specially trained physicians, can then determine whether or not there is something called a disease process or a lesion, something abnormal with one of the organ systems, everything from the epidermal to the neurological. So it's basically the very basic, I can talk about this for hours, but it's the very basic definition of a CAT scan. I don't know the exact number of medical inventions that have been created through the use of the Apollo program or the Space Shuttle program. I can tell you in the work that I do, in terms of radiology and interventional radiology, biopsy systems and digital imaging systems for things like breast biopsies have a huge part due to the Apollo space program. Various types of catheters and which are devices inserted into a vessel to not only look at or scope, but also to become therapeutic or treat an area of disease in a vessel, have been developed. I know that there is some study going on with various suits that are being developed and used now in our emergency room traumas. I do work in a level 2 trauma facility that help lower core body temperature extremely fast to induce a artificial hyperthermia, which helps preserve organs in times of trauma. Very specific types of programmable pacemakers, which we've talked about, and even tools for cardiac surgery. Very fine tools that have been developed for space. The space program have been used. So it's quite a long list. I'm sure there's many more. Those are the ones that I know of and that I've been able to look into in terms of related to my field.